first of all, what is the Skinny Shot and the Skinny Shot Plus? The Skinny Shot is the medication known as semaglutide. The Skinny Shot Plus is the medication known as tirzepatide. Both are part of the GLP-1 agonist drug class and work very similarly. The Skinny Shot, semaglutide, works by decreasing thirst and hunger in the brain and delaying gastric emptying in the stomach, which is just a fancy way to say food rests in your stomach a little bit longer than you're used to, so you feel full longer and faster. Both medications have the goal of decreasing overall hunger and caloric intake, which is what actually leads to our weight loss. One question we often get is, who is a good candidate for the Skinny Shot? GLP-1 agonists such as semaglutide or tirzepatide do have a black box warning for patients with medullary thyroid cancer. However, if you don't have medullary thyroid cancer and you want to lose either 5 up to 150 pounds or more, you could definitely be a candidate for the Skinny Shot. Age or gender are not related to who or is not a good candidate. So if you are between the ages of 18 and 65 years old or beyond, and you've struggled with weight loss or weight maintenance, the Skinny Shot could be great for you. So how can Austin Plastic Surgeon help you receive the Skinny Shot? You have several different options. Of course, we can do in-office appointments or virtual appointments. When it comes to determining which medication is best for you, one of our awesome providers will come to that decision with you. It's always a shared decision. It's never just us telling you what to do. Once we decide what medication is good for you, you have the option of picking it up in our office, getting the medication shipped to you, or even writing a prescription for you to get it from your own pharmacy of choice. Here at Austin Plastic Surgeon, we have kind of prided ourselves on having providers available to patients and keeping a good stock of these medications here in the office, so that way you are always taken care of. One common question we receive when talking about the Skinny Shot is, will I gain weight after coming off of the Skinny Shot? The short answer is it's up to you. We use the Skinny Shot as a tool rather than a crutch to help our patients lose weight. And part of that means we have to form these good habits throughout the process. We have to eat a clean diet, we have to learn appropriate portions, and we also have to stay active with exercise, of course. Once we get to our goal weight and we start to come off the Skinny Shot, we like to taper our patients off so we can make sure we hold on to these good habits and this new lifestyle, which will help us maintain the same weight. If we revert back to other habits like overeating or eating fried, greasy, heavier foods, it is very possible to regain the weight. But again, good habits and a healthy lifestyle are going to be everything when in the Skinny Shot process. So what side effects do we see with the Skinny Shot? I will kind of be upfront and say that the Skinny Shot has shown us very few side effects when you compare it to the other weight loss medications like phentermine and orlistat, and that's why we love these medications so much. However, some common side effects you may see when taking both Skinny Shot or Skinny Shot Plus could be nausea, upset stomach, headache, fatigue, or even a little bit of indigestion. What I always educate patients is that if we eat a clean diet and keep up with that water intake, focusing on clean and lean proteins like chicken, fish, and turkey, we can mitigate a lot of these side effects, but also build good habits which help us decrease weight gain when coming off the medication. So does the Skinny Shot target certain areas? The Skinny Shot does not necessarily target a specific area of fat. It reaches for kind of generalized weight loss, and that's because when you give the injection, it's delivered systemically to your body rather than expecting, if you give it in the abdomen, it's going to stay there and only burn fat there. The method of weight loss that the Skinny Shot uses is a systemic or a generalized fat loss throughout the body rather than targeting a specific area. However, if you do want to lose weight in a specific area, we recommend that you exercise that area, whether that be your lower abdomen, your love handles, or whatever problem area you're focusing on with us. Thanks. So one common question that we do get often with the Skinny Shot is, does it matter where you give the injection? We instruct the patient to give the injection as a subcutaneous injection, which means it goes into the fat. Most commonly, that's going to be the abdomen, the back of the arm, or the anterior, the front of the thighs. Some patients say that they do feel a difference related to where they give the injection. Although there's no research right now pertaining to one site being more beneficial than the others, what I often educate patients is, if you feel better when you give the injection in the thigh compared to the abdomen, of course, please stick to the thigh. Again, we haven't seen research related to one site being better than another, but every patient's different, and if you feel best giving the injection in a specific site, stick to that. So what's the difference between our Skinny Shot and our Skinny Shot Plus? Our Skinny Shot is the medication known by semaglutide, which has the brand names Ozempic and Wegovy. Our Skinny Shot Plus is the medication known as tirzepatide, which has the brand name Mounjaro or Zepbound. To be frank, both medications work really, really well. With semaglutide, we see somewhere between 15 up to like 18% of total body weight loss. With tirzepatide, it's usually somewhere between 22 to 22.5% of total body weight loss. Both are part of the GLP-1 agonist class, which decrease thirst and hunger and delay gastric emptying, leading to you being in a caloric deficit. The tirzepatide does contain something, though, called a glucose-dependent insulinotropic polypeptide, or a GIP, which in layman's terms helps you process sugars a little bit more efficiently, which leads to that greater weight loss. However, both drugs work really, really good at helping us decrease weight and helping the patients reach their weight loss goals.